Hello, you're watching Wellness Watch on DD India, your weekly dose of wellness and good health. We all want a long life, but more importantly, a healthy one. Welcome to the show that cares for you. Today's episode focuses on women health, which often is neglected by most women unless it gets serious. How many times have you thought that a particular health condition cannot happen to me? Cervical cancer, the fourth most common cancer in women, does not seek permission before striking. It grows quietly, without pain, without warning, unless it changes lives forever. The tragedy is not the disease itself, but the lack of timely screening. What are the warning signs? How often should you get screened? And how can it be defeated? Today in Wellness Watch, we discuss cervical cancer. I'm Preeti Kaur. Women frequently place family and professional duties above their own health. This neglect, combined with modern lifestyle shifts, has increased the risk of cervical cancer. January is the Cervical Cancer Awareness Month, drawing attention to one of the most common yet preventable cancers that are affecting women. Often progressing silently, cervical cancer can turn fatal if ignored. However, timely screening, vaccination, and early treatment can save lives. Understanding its symptoms, causes, and prevention is the key. Here's a report by DD India's Harshita Oberoi.
Cervical cancer remains one of the most common and deadly cancers affecting women. Cervical cancer develops slowly and may not show warning signs in its early stages. As the disease advances, women may experience persistent lower abdominal pain, bleeding after intercourse, and abnormal vaginal discharge. These symptoms are often dismissed, leading to delayed diagnosis and advanced disease. Cervical cancer is a growth of cells that starts in the cervix. The cervix is the lower part of the uterus that connects to the vagina. The leading cause of cervical cancer is infection with the human papillomavirus or HPV. Certain high risk strains of the HPV can cause abnormal changes in cervical cells, eventually leading to cancer. Several factors raise the risk of developing cervical cancer. These include unsafe sexual practices, multiple sexual partners, smoking, weakened immunity, and prolonged use of oral contraceptive pills. Women with limited access to healthcare are also at higher risk due to lack of screening. Treatment depends on the stage at which cervical cancer is detected. In early stages, procedures such as cryotherapy, thermal ablation, or conization can remove abnormal cells. Advanced cases may require surgery like hysterectomy, along with radiotherapy or chemotherapy. Cervical cancer is largely preventable. HPV vaccination offers strong protection, especially when given at a young age. Regular screening through pap smear and other tests help detect precancerous changes early, allowing timely treatment before cancer develops. Cervical cancer need not claim lives. Awareness, prevention, and early action can make this disease preventable, treatable, and beatable. Harshita Oberoi's report, Wellness Watch, DD India.
All right, so cervical cancer is caused by persistent infection with human papillomavirus. Women living with HIV are 6 times more likely to develop cervical cancer as compared to women without HIV. Now, according to the WHO, cervical cancer is caused by persistent infection with HPV. Women living with HIV are 6 times more likely to develop cervical cancer. In India, cervical cancer remains a major health issue. This is the third most common cancer in women. It often does not cause symptoms until it begins to spread. That is why regular screenings and the HPV vaccine are very important. Today, we look for these answers in the show. How does HPV cause cervical cancer? How is it detected early? What are the types and stages of cervical cancer? Is cervical cancer fatal? We also discuss what are the medical advancements in India. Cervical cancer treatment in India combines advanced care with affordability using methods like surgery, radiation, chemotherapy, targeted therapy, and immunotherapy tailored to cancer stage by expert oncologists in specialized centers. India offers cost-effective care as compared to Western countries, depending on the stage and the hospital, focusing on personalized plans, early detection via HPV testing, and also advanced technologies like the robotic surgery. Ayushman Bharat program also supports screening and care at Ayushman Arogya Mandirs. Upon our screens, we have some institutes and hospitals that specially cater to this. All India Institute of Medical Sciences, Delhi. Chittaranjan National Cancer Institute, Kolkata. Rajiv Gandhi Cancer Institute and Research Centre, Delhi. Kidwai Memorial Institute of Oncology, Bangalore. Postgraduate Institute of Medical Education and Research, Chandigarh. All right, to help us understand cervical cancer better, we're joined in by specialists today. We're joined in by Dr. Jyoti Meena, Professor, Department of Obstetrics and Gynecology, AIMS. She's joining us virtually. And we have with us in the studio Dr. Sarita Shamsundar. She's Professor, Gyne-Oncology, Safdarjung Hospital. Thank you so much, both of you, for joining us this afternoon on Wellness Watch. Dr. Shamsundar, to begin with, I would want you to explain to our viewers, how does HPV cause cervical cancer?
Yes, good afternoon, and it's good that you're doing this in the cervical cancer awareness month. Cervical cancer is not the third, but it's the second commonest cancer in women, and in fact, one in every 7 minutes, one woman dies of cervical cancer in our country. So the cause of cervical cancer is infection with a virus, that is human papillomavirus, which is acquired. The infection spreads by sexual contact. So so that is when the infection occurs, and the first time the lady has sexual intercourse, that's when there is entry of the virus. And a lot of women get infection, but they clear it on their own because of their natural immunity. But if there is persistent infection, if there is repeated infection by a partner who's already infected, or there is there are associated cofactors like sexually transmitted infections or smoking and low nutrition and the human HIV, that is infection with the virus, and any immunosuppression can lead to persistent infection, and that leads to pre-cancer and then cancer. So the time from HPV infection to the time it causes cancer can take about 10 years. So there is enough time for the ladies to get themselves screened and treated for precancerous lesions.
All right, I'll take that forward to Dr. Meena. Dr. Meena, it is around 10 years of time that it takes for the HPV virus to progress into a cancer. How is it detected early, and what are the early symptoms that a woman should look out for?
So, as Dr. Sarita has already told, that HPV infection is the main cause for cervical cancer. So, not only the infection, but its persistent integration is important. So, during it is very important that the women they get screened themselves. So, we have various screening methods to detect it early. Like everybody must be aware about the PEP test. So we have PEP test and also the HPV test, and also we have VIA, that is the visual inspection with acetic acid test. So these are the tests which are available at hospitals, and the women just need to go and get themselves screened. But it is very important for them to understand that despite they don't have any problems, because most of the women, the concern is, if I don't have a problem, then why should I go and screen? So this is a silent type of cancer, and when the symptoms occur, it is already quite late. So if there are any symptoms, like there are foul smelling discharge, there is postcoital bleeding, or patient is having a postmenopausal bleeding, then they should seek early to the hospital. They should go and consult their doctor. But even without these symptoms, if they are going for a regular screening, like for PEP test, we have regular screening at every 3 yearly. If they are going with HPV test, then every 5 to 10 yearly they can get screened with this test. And after these tests, if there is any abnormality, then we have various methods and various treatment options, so that if it is detected in a precancerous phase, then it can be treated. But the most important thing is, even if there is an HPV infection, that doesn't mean that the lady has cancer. It is just an infection. In about 80% women, this infection clears off within 1 to 2 years. But if it persists beyond that, then they are at high risk of developing precancerous lesion and later on cervical cancer.
All right, Dr. Shamsundar, when we talk of the types and stages of cervical cancer, what are the stages of cervical cancer and when does it, become incurable?
Yeah, so there are 4 stages of cancer. So that is, stage 1 is when it's just confined to the cervix. It is not spread outside. Stage 2, when it is spreads beyond the cervix to the surrounding areas, and stage 3 is even further spread, and stage 4 when it is going, to the bladder and to the intestine, the bowel, or it can spread any
And
part
all
of
of
the
this
body.
happens silently without any
Yeah,
symptoms?
in the first stage it is silent, but the second stage generally the lady has some bleeding or discharge, or it can be in the stage 3 when it spreads to the surrounding areas. It can it can spread to the invade the nerves, and then there is severe pain. So so the early stage, there can be no symptoms. The only symptom the lady may have is pain, bleeding after intercourse, or they can be just a little bit of discharge, but then it can, she may just ignore it if it, just gets treated with antibiotics. So the early stage, it's important to pick up the pre-cancer and the early cancer. So it is the screening which helps in picking up these early cancers, because if it's screened and it is detected in the early stages, the survival is very good. It's 95%. But in the late stage it can be very low. It's like only about 20-30% is the survival.
All right, Dr. Jyoti Meena, 10 years is what ma'am did tell us, but then uh, for how long can cervical cancer go unnoticed, one? And secondly, how is it diagnosed, as you told us about the pap test? Help us understand, what are the early symptoms? Ma'am did tell us, Dr. Shamsundar did tell us that it is early, the early symptoms, but when is it the time for a lady to take that seriously or to take that to a specialist?
So, regarding the symptoms, if the patient is persistently having discharge per vagina, which can be foul smelling, or it can be persistent copious discharge, or it can be a blood mixed discharge, then the women should seek medical advice. Besides this, if the patient is experiencing postcoital bleeding, that is, after having sex, she is experiencing bleeding, or patient is having irregular or persistent irregularity in the bleeding, then it is also one of the sign. And if a patient has attained menopause, and after menopause she again starts having bleeding, or patient is having chronic, along with the discharge she is having chronic abdominal pain, as Dr. Sarita has already told, when it encroaches the nearby organs, then the patient may experience severe abdominal pain as well. So these are the symptoms which the women should not neglect and should seek medical advice.
All right, Dr. Shamsundar, is cervical cancer always fatal? Or if I would put it the other way around, what is the survival rate in such cases? And if once cured, is it cured completely, or are there chances of, a woman getting cervical cancer back again?
Yeah, as I said, once the treatment of cervical cancer involves, if it's very early, it is surgery, and it can be, if it is, if there are some high risk factors, they can need to go for chemo radiation. So there's chemotherapy and radiotherapy. So which can take time, the course of radiotherapy can give, it's not just one time, so it's given over fractions. So it can take a month or 1.5 months to 2 months for the treatment. So if the treatment is complete, then the survival is very good in the early stages. But also, however, even after treatment, we also have to follow up. So, we follow up more frequently in the first 2 years, and then every 6 monthly for the next for up to 5 years, and then yearly. So, the follow up is very important, because if there is recurrence, then we can pick it up and then we can treat. So, it is very important that follow up is important. The completion of treatment is important, because that is where, there is a challenge. Ladies do not come, they do not get the treatment complete, the complete treatment, and then they don't come for follow up. So that is when we, that becomes a challenge if there is recurrence, and to treat the recurrence is again very difficult.
All right, Dr. Meena, is cervical cancer genetic? One, and is there any particular age group of women who are more prone to getting cervical cancer or the virus?
So, yes, some genetic mutations have been identified for cervical cancer, but not always it is a genetic predisposition. And for cervical cancer, there is a bimodal age, that is at 35, 40 years, it is one peak, and then it comes at 50 to 60 years. So, that's why WHO also recommends that all the women who are above 30, that is between 30 to 49, they should get their screening done, because screening is the only modality by which we can detect it early. So, but 30 to 49 is the eligible age group. But if a patient has not been previously screened, then beyond 49, that is 50 above, they should also be screened. So the WHO says that at least twice in a lifetime, the women should be screened so that it can be detected early.
All right.
Important
Yes.
factor in prevention is also, vaccination. So, vaccination starting at 9 years of age. So, 9 to 14 is the best age for vaccination, because that's when there is very good antibody response. So, if the girls are vaccinated and then later on they are screened, so this is, it's very good. It can just protect you 100% from cervical cancer.
Yes. All right. What are the risk factors, ma'am, when we talk of cervical cancer? And also, again, how can we lower the risks?
Yeah, so as I said, it's a viral infection and it is sexually transmitted. So the number of sexual partners, if the number of multiple sexual partners, then the risk increases.
More risk.
Yes, and then associated also the infection. So if there is associated infection, so that leads to the virus then stays in the body, and then anemia, smoking, all these are factors which increase the risk. So that leads to the virus persistent, it stays in the body. Because a lot of women also clear it on their own, so it's because it's just like common cold. So if your immunity is low, then you can have persistent infection.
All right. Dr. Meena, when we talk of the treatment, then does the treatment of cervical cancer have side effects?
See, if we are going with the treatment, there are various, the modalities are surgical management is there. So depending on the stage, there can be surgical complications as well. But usually the surgery is the best modality if it is treated, diagnosed early. If we go for the advanced stage where we have radiotherapy and chemotherapy, so yes, for chemoradiation there are side effects, but these are the minor side effects which can be reduced with the medicines. So usually the chemotherapy side effects will be, patient will have nausea, vomiting, and sometimes alopecia, but these are not that troublesome. With radiation, yes, there can be some sort of stenosis and radiation proctitis, but with the newer techniques now, these side effects are relatively less and they are manageable. So as such, there are no adverse side effects or adverse events which the patient should fear of, because these treatment, they are safe and they benefit the patient more. And the outcome, her survival outcome, as well as the quality of life also improves with this treatments. So there is no, as such, no harmful side effects with any management of cervical cancer.
All right. Dr. Shamsundar, when we talk of medical advancements in India, where is India standing on the global page with regard to cervical cancer?
I think we've got all the treatments available for cervical cancer, all the the surgical techniques, and then the treatments, immunotherapy, which is useful in the advanced stage especially. So we have everything. We have the vaccine, so we have everything available actually.
Ma'am, would you add to it, Dr. Meena, the medical advancements in India with regard to cervical cancer?
Yeah, so as Dr. Sarita has already told, yes, their advancements are now in form of immunotherapy also. So PDL1 is one of the receptor, and the immunotherapy, pembrolizumab, which is FDA approved, and rest others, they are in trial, but they are in concurrent with chemo radiation. So chemo radiation is main. In addition, there are targeted therapies.
All right, so for our viewers who've just joined in, today we're discussing cervical cancer and our specialists are helping us understand it better. Next, we have a quick rapid fire round where I ask you some mythbusters and you will clear those myths for us. Natural remedies cure HPV. Dr. Meena, is it so?
No, natural remedies will not cure cervical cancer. It is the screening and vaccination which will help in preventing cervical cancer.
If a woman gets the HPV vaccine, she no longer needs the PAP or the HPV test. Dr. Shyam Sundar.
No, screening is also needed along with vaccination. So because a vaccine can only prevent the entry of the virus, but there could be some viruses which may still have entered. So it can enter, and that can cause changes in the cells. So it's picking up once the PAP test or the HPV test can pick up any further infections and changes that can happen, and those can be treated early.
Dr. Meena, only promiscuous people get cervical cancer.
No, it's not. It's not true. There are other risk factors which play in role in this. So one important thing is early sexual activity, multiparity, then multiple sexual partners, then even the socioeconomic status, smoking, then immunocompromised states. These are all things which can help in progression
Spread
of
progression.
this.
Early cervical cancer always has symptoms. Dr. Shyam Sundar.
Not always. Yeah, so that is why it's screening. It's very early. And there is a stage called micro-invasive cancer when the cancer is not, there is no clinically. I mean, we cannot see the growth, but it's there in the tissue, in the epithelium. So it's only a biopsy which can pick up this micro-invasive stage, and there are no symptoms when there is a micro-invasive. So that is where the screening is going to help. It's only when there is a growth, when it breaks the epithelium, it's coming out on the surface. That's when it can cause symptoms like bleeding, discharge. But it was when it's still inside the lining, the epithelium. So that's at that time there are no symptoms.
An abnormal PAP test is an accurate cervical cancer diagnosis. Dr. Meena.
So abnormal pap test doesn't mean that patient has cervical cancer. For this, we have to do further test. We have to triage it, either triaging with the HPV test, or we can do a colposcopy where we apply acetic acid and Lugol's iodine. And if there is an abnormal area, we take a biopsy and see whether it is a precancerous lesion or cancer. So the patient does not need to worry that she has abnormal PAPs and she has cancer. It further needs
Right. One does not need regular screening if vaccinated. Dr. Shyam Sundar.
No, as I said earlier, screening is still needed. So it is regular screening, and after vaccination, what the WHO recommends is screening with the HPV test, because that can pick up better. There is infection, and then it can be treated.
Right, so screening and awareness
Both.
is what helps us protect it. Thank you so much, both of you, for joining us this afternoon on Wellness Watch and helping us understand cervical cancer better. So after this discussion, we did understand that cervical cancer is not just a disease of the cervix, it is the disease of delay. Delay in testing, delay in believing that it can happen to us. This is one cancer we can stop before it starts. Awareness is the cure before the disease. Screening saves lives, vaccination protects future. Remember, when caught early, it is not a death sentence, it is a missed threat. With that, we end this discussion here. Thanks for watching. Bye-bye.